You know that feeling when you wake up tired, even after a full night's sleep, when you push through your day running on empty, wondering where your energy went? Here's something most people don't know, that fatigue may actually be happening inside your cells. That's why I've been using anti-factor lipids powder from Nutritional Therapeutics for years. I don't go a day without it. It's based on over 20 years of research and a patented process called membrane lipid replacement, which actually repairs the damaged components of your cell membranes, restoring your cell's ability to produce energy the way they did when you were younger. Clinical studies show anti-factor can reduce fatigue by up to 40%. Just 1 or 2 scoops a day. Mix it in a smoothie like I do, sprinkle it on food, and you're giving your body the science of youthful energy. Anti-Factor Lipids Powder comes in 2 convenient sizes. For more information and to order, just call 800-982-9158, 800-982-9158, or go to antifactor.com. That's antifactor.com for Anti-Factor Lipids Powder.
Welcome to Leyla Weighs In here on the Intelligent Medicine podcast. Thanks for downloading these. If you haven't already subscribed to the Intelligent Medicine newsletter, go to drhoffman.com and subscribe. You'll get it in 2 batches. Mine comes earlier in the week. My portion of it, Dr. Hoffman's newsletter, comes a little later in the week. And you can unsubscribe at any time. We don't use your email for any other purpose. If you'd rather just go to the website, you could go to the website and find all the articles and all of these podcasts there, as you well know if you're listening to this podcast. If you'd like to make an appointment with me, call the number 212-779-1744. That's 212-779-1744. I want to talk to you about clearing brain toxins and the role of sleep. How while we're sleeping is rest and repair, but it's also a very active state of housekeeping and sweeping and cleaning and detoxing. So this is about clearing brain toxins and the role of sleep and the role of glymphatic flow. I'm going to explain that. So for many people, unfortunately, sleep may seem elusive, but it's really essential to many physiological functions. We do need sleep. One of those essential functions may be the clearing of toxins from the brain. Glymphatic flow, like lymphatic, you know how our bodily lymphatic system clears out toxins and things. That's the role, the lymphatic system. This is the glymphatic system as having to do with the brain. The glymphatic flow is part of the brain's natural detoxification and repair system. And both human and animal studies suggest that the glymphatic fluid system is a network primarily active and enhanced during sleep that promotes the removal of toxic proteins and waste metabolites from the brain through the cerebrospinal fluid movement and interstitial fluid interactions. So this is important. Research studies continue to investigate the glymphatic system, not only for its potential role in various disease pathologies, such as neurodegenerative diseases, sleep disorders, and migraine, but also for those health conditions such as metabolic syndrome and other vascular risk factors that may adversely affect its toxin-clearing functions. So, what is the latest human research regarding the glymphatic system and the mechanisms involved? How does sleep quality benefit this waste removal system and ultimately brain health? This is actually a wonderful article from the Institute of Functional Medicine. So the word glymphatic is a portmanteau of the word glial and lymphatic, highlighting the role that glial cells in the brain are theorized to play in helping rid the brain of waste in a manner that's similar to the lymphatic system, as I alluded to earlier. While a complete understanding of the fluid dynamics has not yet been reached, research into the glymphatic system highlights the role of sleep in the clearance of many neurotoxins. Significantly more active during sleep, the glymphatic system uses a network of vascular channels and spaces that facilitates the movement of the cerebrospinal fluid in the brain. This cerebrospinal fluid, the CSF, flows into the brain along these spaces, mixes with the interstitial fluid that contains metabolic waste products from the neural cells, from the brain cells, and transports harmful proteins and other waste out along these perivenous spaces, these spaces in and around the veins. As an example, amyloid beta buildup, which is heavily implicated in Alzheimer's disease, is transported out of the brain via this pathway. And studies have confirmed similar findings of amyloid beta accumulation during sleep deprivation in humans. So, that amyloid beta buildup and it's being able to be metabolized out, that's a metabolic function of the brain. It's not like the amyloid beta plaque is bad. It's you don't want an accumulation of it. Let me compare it. Let me make an analogy to insulin resistance. It's not that all that insulin is bad. It's that insulin is there to do a job, not build up like that and have your cells not be sensitive to it, right? So, in a 2022 systematic review of 190 articles, which actually include 19,129 total participants, investigated the relationship between sleep and CSF, that's cerebrospinal fluid related, and lymphatic system related components among healthy individuals and those with a pathology, such as an autoimmune or a neurodegenerative or sleep-related conditions. And while there were relationship differences across these different conditions, several associations were found between sleep problems and both increased CSF metabolite concentrations. For an example is amyloid beta and those tau proteins, and the CSF volumes, the cerebrospinal fluid volumes. So let's talk about other routes for brain waste clearance. The glymphatic fluid system is not the only toxin clearance system in the brain. As an example, the meningeal lymphatic vessels also interact closely with the glymphatic system and play a role in the drainage of interstitial fluid, cerebrospinal fluid, molecules, and immune cells. Now, the meningeal lymphatic vessels, the meningia, it's the lining around the brain. That's what they're talking about. If you've ever known someone who's experienced a meningioma, for example, that's a tumor of the brain lining. The meninges, the brain lining, right? So they're talking about the drainage also there. So, as an important component of the brain waste removal system, a decrease in the function of meningeal lymphatic vessels has been associated with neurodegenerative diseases, as well as brain hemorrhages, brain tumors, and trauma. So, research continues to explore how the expanding knowledge regarding the meningeal lymphatic vessels may inform therapies for brain disease treatments, as well as for brain protection. Research studies are continuing to investigate how sleep time, quality, and efficiency impact health outcomes associated with the glymphatic system. So far, findings have not been consistent. A 2023 systematic review of 51 studies that included healthy adults indicated that the outcomes of the glymphatic system may be influenced by changes in sleep, yet the results were inconsistent, and the various sleep assessment methods used in individual studies influenced the findings. In addition, researchers noted that the sleep glymphatic system interaction in humans is notably more complex than what has been observed in animals. So they say that additional study is needed. And for many people, supporting strong sleep habits in general may increase overall health. That is a fact. Poor sleep quality has been associated with an increased risk of developing dementia, a higher rate of depressive symptoms, and an increased odds of mental distress in healthy subjects. Hey, you can't function well if you haven't had enough sleep. You can't. In addition, chronic sleep deprivation has been associated with an increased risk of cardiovascular events and all-cause mortality, as well as impaired glucose metabolism. This is true, especially for those of you with metabolic abnormalities, metabolic syndrome, prediabetes, diabetes. If you haven't had a good night's sleep, your blood sugar is going to be higher. It's true. So, engaging in lifestyle-based routines like mind-body therapies, aerobic exercise, may help to improve sleep. And in addition, higher quality diets with more nutrient-dense foods may also positively impact sleep-related outcomes. Restorative sleep is essential for mental, physical, and emotional well-being. So you have to cover all of your bases. It's not just a matter of eating a healthy diet and drinking pure, clean, filtered water and getting enough sunshine and exercising on a regular basis. If you're not also pairing that up with good amounts of sleep and good deep sleep, good quality sleep, you're not going to be able to enhance your health, restore your health as well as you would like to, because restorative sleep is essential for emotional well-being, physical well-being, mental well-being. Understanding a person's sleep quality and any sleep disturbances that they're experiencing, it's an important part of assessing, of having a proper screening tool to address health concerns, as well as to help someone adopt healthy sleep habits. So in functional medicine and nutrition, a close working relationship between a clinician, a patient, can help identify sleep troubles and develop a personalized treatment intervention that implements effective behavioral and lifestyle therapies for improved Sleep. Now, what else can impair your sleep? Untreated sleep apnea. And did you know that untreated sleep apnea can age the cardiovascular system faster than smoking? While most Americans know that smoking damages the heart, if you realize that the nightly breathing interruptions of sleep apnea may impose an even more profound burden on the cardiovascular system. So there was a new study that provides compelling evidence that untreated obstructive sleep apnea accelerates cardiovascular aging, which can then significantly increase the risk of premature death. So prolonged intermittent hypoxia, that means a lack of oxygen, creates a cumulative burden on the cardiovascular system that accelerates biological aging. And this silent epidemic deserves the same urgency we reserve for established cardiovascular threats. So, the hidden mechanism behind accelerated heart aging: when breathing stops repeatedly during sleep, the body experiences dangerous drops in oxygen levels. And these events trigger a cascade of physiological responses that stress the cardiovascular system night after night. So this creates oxidative stress, which then, promotes systemic inflammation, as well as neurochemical and physiological reactions that increase the risk of heart disease. This damage, it compounds over time. And modern sleep therapy devices like a CPAP, they help maintain continuous airway pressure during sleep, preventing these oxygen drops before cardiovascular harm can accumulate. So it's really important, if you suffer with obstructive sleep apnea, that you're using your devices and you're using them properly so that you can get a good night's sleep. A higher risk of OSA, obstructive sleep apnea, was associated with greater carotid intima media thickness, right? We're talking about the carotid in your neck, all of that. And these markers reveal arteries aging faster than chronological years would predict. So, recent genetic research has quantified the aging impact of untreated sleep apnea with striking precision. A 2025 bidirectional Mendelian randomization analysis involving more than 820,000 genome-wide variants concluded that genetically predicted obstructive sleep apnea shortens telomeres, which equates to roughly 6 years of additional biological aging. So, and you have to take care of these issues if you have them going on, because a good night's sleep is important for your glymphatic system to do its job, for the meningeal arterial venous system to do its job in removing these metabolic wastes, in preventing the buildup of amyloid beta, because that buildup of amyloid beta is the hallmark of dementia and Alzheimer's disease. And we all need a good night's sleep in addition to sunshine, clean water, exercise, a good clean diet, right? Good clean food. But we need to take care of our sleep. And also don't forget, and the other thing that's adding to the cardiometabolic risk factors when it comes to obstructive sleep apnea is 30 to 50% of people with high blood pressure are caused by the obstructive sleep apnea. So there are these overlapping pathways between sleep apnea and cardiovascular disease. So one worsens the other. A definite risk factor for high blood pressure is obstructive sleep apnea. So unlike smoking, which primarily damages through toxic chemical exposure, sleep apnea harms through repeated stress responses. And research from the National Institutes of Health has helped to clarify these mechanisms. So for every measure of observed reduction in blood oxygen levels or hypoxic burden, a person had a 45% increased associated risk for having a primary cardiovascular event. One well-known study found that people with untreated sleep apnea, really severe obstructive sleep apnea, were nearly 4 times more likely to die over the 20 years of the study than those who didn't have obstructive sleep apnea. So it's important to get treatment. And that's the encouraging news, is that appropriate treatment appears to halt and potentially reverse cardiovascular aging from sleep apnea. If you take care of these problems, your body is very, very resilient at healing itself. So there was a Brazilian trial, found that 6 months of nightly treatment, use of at least 4 hours, helped to stabilize, right, the telomere lengths that they're talking about when it comes to the genetics of this. But again, early diagnosis is critical, getting treatment is critical, whether it's a CPAP or some other device. I know there may be other devices on the horizon, which would be very interesting. But get sleep, clear the toxins from your brain, save your heart, be healthy. I want to thank you for joining me on another edition of Leyla Weighs In. This is Intelligent Medicine.
I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muedin, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.